for Governor Fallin. She is the first woman to ever be elected governor in Oklahoma. And prior to her election in 2011, she represented Oklahoma in several state and federal positions. She served two terms as a state representative before she became the first Republican and first woman lieutenant governor in 1995. From 2006 to 2010, she served as a member of the United States House of Representatives. As a governor, some of her top priorities have included job growth and retention, education reform, workforce development, government modernization, and elimination of government waste. And during her administration, Oklahoma is consistently ranked among the top states for job creation. During her first year as governor, she balanced the state budget while closing $500 million deficit and lowering the income tax rate. The same year, during her first year, she also saw many of her legislative priorities signed into law, including lawsuit reform, comprehensive education reform, and other government modernizations. This year, the governor signed some important pieces of her agenda for Oklahoma into law, including another tax cut, a historic overhaul in the workers' compensation system that will lower the cost for all businesses, and targeting funding increases for education, healthcare, and infrastructure, which benefited us directly. Additionally, she has launched an initiative to increase the number of college graduates in Oklahoma to help the state attract and retain jobs. She's implemented a road and bridge plan that will eliminate the deficient bridges in on the state highway system. And finally, she's introduced the state's first ever comprehensive energy plan on developing and finding new markets for Oklahoma's plentiful natural resources. In August of 2013, she'll become the chairman of the National Governors Association. But like that, with this, I'd like to invite Governor Fallin to come up and make some comments.
You're making this day very special for me. Thank you very much. And what a wonderful crowd we have today. Doctor, thank you so much for that very kind introduction. It's a pleasure to be here at the hospital and to see all of the people that are represented here today. I also want to just start out by introducing another person that I want you to give credit for too, that's helped the OSU Medical Center, and that is our Secretary of Finance and Budget, Preston Dorflinger, who's a Tulsa. He has worked tirelessly, and of course he's from Tulsa, so he knows the importance of this facility, and we appreciate his great service to our state. But Dr. Chamberlain, thank you for all that you're doing, and we certainly appreciate your work here on the campus. And I have a small connection to him. He is a good friend of my stepson, Dr. Blake Christensen, and he told me to tell you hi. He said, hope you're doing well. Tell me to tell all the other students, hang in there, it'll be all right. He knows, but we are very appreciative of the OSU Medical Center and all that you do here at this great facility. And to all of you in the room, thank you for your service to helping us provide better health care in the state of Oklahoma. And of course, President Howard Barnett, I've known him for many, many years, and I was listening to your comments and watching the video about how we had this in our budget. We did, and someone said you didn't even have to come scream at us per se, but Howard was. No, Howard spent a lot of hours in our office, along with Jamie Longacre and other people, and Dean Strum. We appreciate you and all that you do. Thank you for your great service, and it's been a great pleasure to work with Howard. And certainly Howard's been President Barnett's been a wonderful advocate for this medical facility and for health care in Oklahoma, and certainly is very capable of explaining the needs of our state, which we know and we support and appreciate all your service. So thank you for what you do, Howard. We appreciate you. It's great to see our regents here. Thank you for your service and all that both of you do, and the medical trustees, thank you for coming here today. And certainly we appreciate all the osteopathic community in our state. become very familiar with you also. So thank you for your contributions and helping us improve our health care of Oklahoma too. And finally, I gotta say, just congratulations to the students. And what a wonderful presentation you did. We're glad you're in Oklahoma, and I know there are other people here from out of state, but to all of our students that are represented here today, I know it's hard work. It's a lot of long hours, many hours of studying, sacrifices, financial sacrifices, but you are doing a great thing for not only our state, but certainly for our nation, and entering into the healthcare profession is something that we really need desperately, has been enumerated here in the video and the various talks that we have heard. So I appreciate all of our students and your work, and I just want you to know that one of my top priorities as governor has been to work with our various state entities, certainly our public health institution, certainly our medical community itself, and frankly our communities on improving the overall health of our state and creating better access to care in our state. We know that we do have challenges with our health system, not only here in Oklahoma, but certainly throughout the nation too. And I can still remember when I started off as governor, we were ranked somewhere around 49th in the nation in overall health indicator outcomes. Too much high rates of obesity, diabetes, heart conditions, too much smoking in the state of Oklahoma. You all know these things. We need to do a better job of eating right, exercising, taking charge of our own health, being responsible for our health. But you see those people that come through the emergency room that don't always do those things. Some try, but some just don't quite get there yet. And so that's the charge that you're answering, is to help us answer the call to improve the overall health of the state of Oklahoma, which is critical for not only our personal well-being, but it's critical for our businesses, that we have a healthier workforce. It's critical for our families, that they have healthy family members. It's critical for our state budget, because we end up paying out one way or the other in healthcare services and illnesses, and it's critical for our business community for the healthcare costs that they pay in healthcare premiums, and certainly for having a healthy workforce in our state. And so we've been making some progress. We've now moved from 49th to 43rd in better health. Not quite there, but boy, we've moved the needle, which is the best thing, and we're moving it in a better direction. And moving forward, we're going to continue to work towards common sense policies that will help empower our citizens, certainly educate our citizens on the importance of health care, work on the various institutions and systems themselves, such as the medical school, the residency programs in our state, and the OSU Medical Center is certainly one of the keys to helping us work on our health of our citizens. And it's critical, especially here in Tulsa. I heard the comments many times that you see 45,000 patients that come through the emergency room. 19,000 of those visitors don't have funds to be able to pay for their care. We know that, we understand that, and that's why we're trying to take care of our uninsured in our state and those that are medically challenged. And so the mission of this facility and the physicians that are here and the staff that's here is critical. It's critical to the overall well-being of the health of our citizens. And this hospital, this medical school, is helping us with, certainly has been mentioned, the lack of physicians in our state, which is a huge challenge. We know that 64 of Oklahoma's 77 counties are experiencing health professional shortages, and that's a big problem for our state, especially as we're seeing national changes in our healthcare system. We also know that Oklahoma is ranked 44th in the nation in primary care physician shortages, and we got to do better in that particular area too. And when we have the lack of physicians, when we have a lack of rural health services, primary care services in our state, when we frankly have a lack of residency slots in our program, which I understand quite well, that means that we aren't able to provide access to the kind of care and services that we want to provide to our citizens. And so you're all part of meeting the challenges of tomorrow with this medical center. And so we did add more money to our budget for the residency slots, which we were excited to do last year, and certainly more money this year. We are proud to put into our budget to help with keeping the medical school open, to help you get more federal funds, to be able to match the money, and to certainly improve the quality of care. I also had a great tour of your newly remodeled emergency center, emergency room. Congratulations on that. That's a great addition to this facility. So I'm just here to say thank you for what you do. We appreciate our students. We appreciate those that are entering into the field. It is essential and important for Oklahoma that we do have health professionals in our state and that we have an adequate number of health professionals in our state. It's important to our families. It's important to our businesses. It's important to the overall health and well-being of our citizens. So congratulations to all of our students. President Barnett, we appreciate your leadership. Dean Strum, we appreciate what you're doing. And Dr. Chamberlain, thank you for that very kind introduction. Thank you so much. It's a great honor to be with you.